GLP-1s are extremely interesting and they work in a multitude of different ways. These medications can act centrally on the brain, where they can assist with hedonistic or hedonic pathways, which is the pursuit of pleasure. So foods such as chocolate or highly processed carbohydrates, other foods that would usually spike your dopamine or give you pleasure when eating, your brain tends to tune those down a little bit, which makes dealing with cravings and things like that much easier. It also acts centrally in order to reproduce the effects of feeling full. So your body feels full sooner than it usually would, which is a problem with a lot of our patients who have a disconnect between their stomach fullness feeling and their brain. It also acts on the stomach itself, where it reduces gastric emptying, and that also promotes the feeling that you feel nice and full. You don't have to eat as much as you don't have to clear the whole plate like you usually would. You can eat until you are full, and that's usually a lot less. Then it acts on the blood vessels itself, and that helps to produce a decrease in all risk cardiovascular mortality. So that's risk with heart attacks and strokes and the rest of it. It acts without insulin, as we know. So for patients who are diabetic or pre-diabetic, it helps to increase insulin production, and it helps to decrease the amount of glucose that gets produced. And then it helps you to actually take that glucose and put it into your muscles, into places where it's needed, so it's not just sitting around causing problems. Lastly, it actually works on the fat cells itself, where it actually helps to break down the fat in the process called lipolysis, where it actually helps to get rid of the fat itself. These are only some of the mechanisms by which these drugs work, and we're discovering more and more of these as time goes on. But they are truly becoming very, very interesting medications in this field.